Hi, hi.
So today's episode is breastfeeding.
Before we jump into the episode, if you hear me that's like very nasally, it's because I'm sick.
It's first week of school, so
Yeah.
that's what's gonna happen.
And also, if you also hear us like panting is the word. Panting is because we just tried the TikTok trend with the penguins, like the 3-6 Mafia, something, whatever.
Check out our
That is
TikTok
super
for that.
cute. I cannot believe that I struggled that much for that choreography.
I'm all over the place.
I can't breathe.
How many takes did we do?
No, we did like 10. I couldn't believe how long it took to do that. I thought it was going to be like a 5-minute thing. No. We were definitely dancing
30
and trying to
minutes?
do like 30 minutes for sure.
At least.
And
Because
on Patreon, they're going to see us because we're like flushed right now.
Oh, yeah. So we're recording this behind the scenes. It's going to go up on Patreon, and you're going to see us just, at least me right now, I'm fanning myself with my hands, so
I know.
there's that. Okay, so we're back.
We're back.
So breastfeeding.
Yes. I think this topic is like really,
Yeah.
it's so good. And I'm actually really excited to talk about breastfeeding.
Yeah.
It's Breastfeeding Awareness Month. We're in our last week of August. So we thought that we should end August with a strong finish with breastfeeding because it's something that Julie and I both did.
Yes.
And we both talk to each other all the time about our breastfeeding journey.
Oh, yeah. First
And-
me, because my child's older, and
Yes.
then after that with you.
And we both struggled.
But you know what? You didn't have a kid yet, and you hadn't breastfed yet, but you gave me one of the most invaluable resources.
Really?
Yes. And
Which one?
I mean, I think about it. Every time I grabbed it, it was a nipple guard.
Oh, the nipple guard. Yeah.
Every time I grabbed the nipple guard, I thought of you. I know that sounds very weird, but it's the truth. Because I was, dude, it hurt so bad because you didn't have a good latch.
Yeah.
And we'll talk about
Nora
that.
had a bad latch too, yeah.
And girl, I remember that I told you that I would literally cry. Like tears would be coming down my eyes every time, at least in the beginning when he would like latch on. And then obviously after that, you just bear down and you're used to it. At least I did.
Yeah.
And I remember telling you that. And you're like, girl, have you tried a nipple guard? And I'm like, what the fuck is that? And I went to Target and I got it. I'm like, oh, let's try it out. Changed my life.
Really?
Changed my life. Thanks to that, I was able to like further breastfeed. And I didn't even breastfeed for that long.
You know
but
what?
all thanks to you.
I didn't use a nipple guard.
Damn. I
didn't take my own recommendation, and I ended up, I think I breastfed until maybe she was like direct breastfeeding, like on the boob.
Yeah.
I think I breastfed till maybe she was like 2 months old, and then after that I
you had
couldn't
to because of
anymore.
work and everything
Well,
too.
yeah, I started work and it was very painful.
Yeah.
Oh my God. And we'll talk more about that, like with breastfeeding and stuff. But it was so painful that I would cry every single time.
So it was painful for you too.
Yeah, no, it was bad. Because she had a bad latch too.
The same thing. Yeah.
She, like, her upper lip would not like flange out. So
Yeah,
she would just like bite down on the nipple. And it was just horrible.
Yeah.
And by the way, if anyone is grossed out by the words boobs, nipple, breast milk,
Not the episode for you.
Cracked nipples, bloody discharge, like this is not for you.
Not for you at all. Not
so
the-
this is
not a
kind
good
of like a
episode for you.
warning.
Yeah. Trigger
this
warning.
can be like pretty graphic, but it's
yeah.
something that needs to be normalized and talked about because
Absolutely.
I did not know. I only knew about breastfeeding stuff because I was a pediatric resident. We have to get trained
Of
in some
course.
sort of lactation.
Of course.
I'm by no means a lactation specialist. However, I can help a person out, with the basics. But it's something that definitely is not talked about. And like after you go through it, I couldn't
Yeah.
I couldn't believe how hard it was.
Because I don't know if you had that same experience, like before you got pregnant, before you went through the whole thing and then gave birth, started breastfeeding. A lot of people, at least to me, made it seem, even online and on social media and all that, they made it seem like you're sitting on top of a lotus flower.
Yeah.
And everything's just so beautiful during pregnancy too.
Yeah.
Everything's beautiful. Everything's so natural. Everything's so like zen, and it's just Mother Nature and that was the furthest thing from the truth.
Yeah, it's not.
Furthest thing from the truth.
It's not.
During pregnancy, after giving birth, during like, no.
And I think it's a lot of people picture it to be something. It is beautiful. Breastfeeding is beautiful. I loved my whole entire time breastfeeding. There was something about giving my daughter my breast milk that I really loved as well. But I don't think I think a lot of people like are also like, oh no, you build this bond, you know, and I'm like, you can have a bond with your baby regardless of the way you feed them.
Absolutely.
You know, whether it's with formula, whether it's with a G tube, whether it's with breastfeeding directly or pumping or like a supplemental nursing system that a lot of women use. All those things. You can create a bond with your baby. So please don't have anyone lie to you about, oh, yeah, you know, it's this bond that you don't get with other kind of, that is false.
No, yeah, that's not
That
true.
is false, and don't let anyone, you know,
absolutely
like, say anything about it. But anyways, I had to exclusively pump because I went back to work and it was impossible. Like Nora, once she got used to the bottle, it was like impossible, and she was so angry and stuff. But anyways, back to the whole entire like basics of breastfeeding.
So what is breastfeeding?
It's basically nursing. So you put your baby on your boob and milk comes out. Exactly. There's no science. It's been around since the beginning of time.
Since the beginning of humans. Yeah.
And
we're mammals.
So what I was gonna say, now that I just said natural, everyone told me, yes, it's so natural, but to all my parents, I say it's the most natural thing to do. Because they just made it seem like...
I literally have that in my notes.
You do?
Yep.
Yeah. They literally just make it seem like you're going to birth this baby.
And the baby just knows. Which they have natural instincts. They have like reflexes.
Rooting reflexes.
That's what
and stuff like that. So they have natural instincts, but you have to work.
You have to guide the baby.
Yeah.
And kind of like... Yeah, they have the reflex for suckling, like you said, the rooting and whatever, but you have to guide the baby, like, you know, and there's several positions on breastfeeding, and then you got to see which one works best for you and baby, you know. It's a lot of things that go with it. It just doesn't happen.
No, exactly. You know? And then, you know, a lot of babies, they have complications, and unfortunately, sometimes that means a separation from the mom initially, and it's not because sometimes I feel like a lot of these places make the medical team out to be like these terrible people.
Yeah.
I agree that there has to be more of a push to not separate parents when it's unnecessary.
Yes.
You know, especially because a lot of hospitals like to follow protocols and stuff. So I'm definitely, like, where I work, I definitely push to try not to separate mom and baby.
Yeah.
But unfortunately, sometimes there is, like, you know, when a baby is premature or when a baby needs, like, intense phototherapy or something like that, unfortunately, we can't be, like, on the breast the entire time.
Right.
And then sometimes we do have to supplement a little bit. But we do try. Like, there's, like, you know, luckily I worked at or I did my residency at a hospital where we had the option to have a breast milk bank.
Yeah.
So for our babies, we were able to get breast milk for them. But there's
awesome.
small hospitals that cannot do breast milk banks. So they, like, babies are on TPN for a really long time. So total parenteral nutrition. So it's basically food through the vein.
Yeah.
So we literally just give, like, the most basics, like, in food. Like, literally carbs, proteins, sugars.
What's needed.
Calcium. Yeah.
Yeah.
And which... If anyone has ever done those orders for TPN, it's just awful. I fucking hate ordering TPN. It's terrible. And for a neonate, it's like, you have to be very specific because their levels can come back like... Anyways.
Yeah.
I mean, I can go on a tangent just on TPN.
Yeah.
But, yeah. So, Julie, like, how was your experience? Because you definitely went through this first. So, what was your first breastfeeding?
So.
First time. Because I remember mine.
Yeah. Oh, and I think you remember this story because I told you this story like right after. You're like, what the fuck? Like, why? Okay. So, gave birth. That's its own story, but that's not the topic of today. And immediately, like, hey, do you want to breastfeed? Yeah, sure. Okay. So, went ahead, tried the latching.
That? Like, from when baby was born?
So they take them to the light, you know,
to the little bed.
Exactly, to the little bed, do the initial investigations and all that stuff and whatever. And then right after that, wrap them up.
Yeah, and then bring them on.
Bring them on. So then the nurse, I had, like, the best team of nurses. Like, they were fantastic, like, honestly.
Yeah.
So then they came up to me with baby, and they're like, oh, do you want to breastfeed? Yeah, sure. Okay, here.
Birth. You don't have to say the hospital, but...
Yeah.
You gave birth in one of the Baptist hospitals?
Yeah.
Okay.
Yeah.
I can't remember because I wasn't here when you gave birth.
That's right.
I I think I was still in medical school.
I think so.
Yeah.
Mm-hmm. Anyway, so oh yeah, that's right. I totally forgot that you weren't here. I mean, that first year of birth was just like
a blur.
It's a blur. But anyway,
I saw pictures of Emar when I first saw him. Anyways.
Okay. Yeah, you were down here for break or something.
Yeah.
So
he was still jaundiced.
I know. Yeah, because that happened to him. He was jaundiced. So I had to go out in the morning and put him with the little sun and all that. And he got over it. Just like, but anyway. So put him in boob. And then, like, since it's the first time, I mean, I just met this baby. This baby just came out of me, So it's already, like, for those of you, that are men, or, obviously women that haven't had kids or anything like that, it's a very strange feeling of, like, all of a sudden, because like, logically in your mind, that you're, making a baby inside, you're pregnant and all that, that this is going to happen and all, you're completely aware of the whole situation. But when that baby comes out, it, like, hits you. At least it hit me like a ton of bricks of, like, oh my God, there's a full ass baby that came out of me. There's a person, like, I created that person in my belly that is over there right now in that table.
Isn't it crazy? It's insane.
I cannot put it in enough words. It's like, I can't describe it well, like, as better than this. So anyway, so all of that is going through your mind. Yeah. You're assimilating all of this. All of these things are going through your mind.
And mind you, we're not trying to say, like, oh my God, it was the best feeling. It's not like good or bad. It's just like in the moment, you're like, holy shit. Like, this is a human.
You're just like trying to take it in. You're trying to, like, have your mind, like, assimilate what's really happening right now. So put baby on me. And then I'm like, okay, I know that let's just do it. She helped me. The nurse helped me. We did the whole thing. And then fine, he started suckling a bit for a while. And I'm just, she will come around every now and then and like, oh, are you done? Or do you want, and I'm like, no, I'm fine. Like, and she's like, yeah, just let it be, like, however long he wants to be there. Yeah. You could go ahead and put the other breasts, however, whatever you guys want. I'm like, okay, yeah, that's fine. Go ahead. Then family members started coming in.
Oh, yeah. Okay, I remember the story.
And I was like, hi, this is me. Like, maybe an hour.
With my boob out.
Yeah. Maybe an hour postpartum. Me, baby.
An hour?
Like, maybe, yeah. Like, maybe. It was, he was still in my boob.
Oh, no.
So then, and I'm like, yeah, here's baby. Here's me, and here's my boob. Hi. Yeah. And then.
You didn't even have time to really, like,
I'm still trying to figure it out.
Yeah, like, process everything.
I'm still trying to figure it out. Yeah. And then I had done, like, the deal with Mario of, like, and Mario had we had agreed that if things became too much, like, in the room and whatever, and I needed people to just get the hell out, like, I'd give him, like, the look or something, or I'd tell him something, and he'd deal with it.
Yeah.
And so it did. Very quickly. Yeah. And I don't even remember if it was something I said or something how I looked at him. And he was there, okay, everybody get out. Like, everybody out. That's it. Thank you for coming. Bye. We'll call you guys when we're at home and ready to see you all. Go. Yeah. So he did God's work in leaving me alone, with my mom and my mother-in-law. But I have a very good relationship with my mother-in-law. She was even there during the birth. Yes, and that was my choice. But I do have a very good relationship with her. Yeah.
Yeah.
Yeah. So anyway, and then from there on out, it, the breastfeeding kept on happening. And at home, oh my God, the morning of, when the nurses are like, okay, so here, you're ready to go, and this and that. And I'm like, can somebody come with me? How are you just sending me out to the world with this baby?
Guys, funny
I don't know what I'm doing.
I ended up finding out when I went to go see Julie that she was like, oh, I think I fractured his skull. Remember when you felt the posterior fontanelle? And you're like, I broke it.
I barely remember that. And
I was like, I know Mario was like, no, Joel, it's supposed to be there.
Because there was one moment, I think I was trying to breastfeed him in a different position. And then my hand was holding his head in a different way. And all of a sudden I felt it. And I'm like, oh my God.
Panic.
Oh,
sheer panic.
What is this? Did I do this? Like, yeah.
Mario was a doctor.
Thank God. Well, he was applying to residency. It was like he actually got into residency that, within a couple of months after that. Yeah. In that March after. So yeah.
Which, by the way, Mario was supposed to take one of his exams.
That's right.
On that day.
He was supposed to take step 3.
Yes.
On the day that I birthed my son. And he had to, listen, he practically needed the blood of a fucking virgin, okay, to submit to the people, to this organization.
Yeah.
To prove of why he couldn't make it to the exam.
That's crazy.
It's crazy. Even my OB-GYN, she was like, whatever you need from me, like, fine. He had to ask her for a letter and everything. And he's like, he was on the phone with them, like, less than, like, just hours later of me giving birth in our birthing, like, room.
Mario couldn't even enjoy.
He couldn't. He was on the phone with them.
Oh my God.
Yeah, like, try to tell them, like, hey, do you want me to send you right now a selfie of me and, with my newborn kid and my wife postpartum? Like, is that what you want? Like, it was ridiculous. But whatever. He was finally able to do it after pretty much, sacrificing a lamb. Mm-hmm. And yeah, but he was supposed to take the step 3, but everything worked out. He took his step 3 another time. He did great, whatever and all that stuff. But
fast forward, he is 5.
Now he's 5. My son's 5 now. Crazy how that was 5 years ago already. Like, it's bonkers.
So the first time that Nora breastfed for me.
Yeah.
Okay. This was during COVID. I gave birth during COVID.
Yeah. And so you birthed her in Tampa.
No, I birthed her here, Jules.
Was it here?
Yeah. At the Jackson hospitals.
Hold on a second.
Remember?
That's right, because you moved over here big pregnant.
Yes.
You were, that's what I'm remembering.
Like 37 weeks pregnant.
That's what I remember. I remember you being big pregnant in Tampa. Okay. Yes.
Yes.
And the whole thing with the insurance. Yes. It's all coming back to me now. Yes. The problem with the insurance and
so everything was figured out, and I was able to give birth at one of the Jackson hospitals. And everything was great. I loved my team of nurses too.
Yeah.
And but when I first of all, that moment where I was literally about to push her out, I don't know if they saw my oxygen go down or something. And honestly, you're in this like state where I remember my OB-GYN coming into the room, and I was so exhausted from the night. And maybe like we can do an episode on like labor, because today is more breastfeeding. But I remember my OB-GYN being like, hey, you're ready to push. And I literally wanted to cry. Those are still to this day probably one of the most beautiful words I've ever heard in my life. Is when your OB-GYN tells you that you're ready to push. And I did not push because I've seen a lot of births, I've seen a lot of labors, and usually one of the things that women do is it's very natural. Like you have this feeling of pushing. So, but I knew that if I wasn't fully dilated and if I started pushing from before, I was gonna be exhausted and I wasn't gonna be able to push when the time came. So, I held all of that to the moment that he was like, "You're ready," and I was like, "Let's fucking go." And I pushed Nora out in like 3 pushes.
Yeah, me too.
I
did the same.
And I remember he was like, "Do you know how to push?" And I'm like, "Nope." And he's like, "You're literally going to push like if you're pooping." And I'm like, "Let's go. Like,
let's get this done.
So I pushed her out in like 3 minutes. But in that interim, like, I don't know if they saw that I like was in distress or I don't know, because at that moment I'm not a doctor.
No, but you're barely even human at that point.
Barely even human at that point.
Yeah, you're just like, there's so much happening.
They put oxygen, like I had the mask on, like there was so many people in the room, even though it was COVID, and it was just me and my mom.
Oh my God.
And I was like so many people in the room, and when I finally give birth to her, they literally throw her on my chest, and I have like still a mental picture of looking down. And I had to rip the oxygen mask off of me. Because I couldn't even see her.
Oh my God.
Because I had like so much. And and I just have like this visual of like Nora like screaming. They take her away and they bring her back to me. And I noticed that it was like already like almost an hour. And I'm like, hey, I really want to breastfeed. And they're like, oh, well, let me get the lactation consultant. And then I'm like, go whoever you want. But, but like give her to me. Because I want to breastfeed. And then they're like, oh, okay, like, let's help you and all these things. And I'm like, just give me the damn baby. So the nurse latched her on, and just in time, the lactation consultant like came in, and I was so grateful that she was there. She was fantastic. I don't remember her name, but she was amazing. And she latched her on, and Nora had like the most perfect latch, like at the beginning. And I was like, wow, like it truly is natural.
Yeah.
And that's it. That was my only good breastfeeding session that I remember. At least I can say my first time. Yeah. First time was like amazingly memorable.
Right.
But that is it. Because I ended up getting like a post-spinal headache.
Oh, shite.
Oh my God. It was awful. It was terrible. And then after that, it was just so painful because she didn't really have a good latch.
Yeah, same here.
Oh my God. My mom... This is one of the things that we can talk about, how like older parents are like, oh, they're so hungry.
Oh my God. You already have enough pressure on you and enough on your shoulders, and you're freaking out, and already too many doubts in your mind.
Yeah.
To then have a Cuban mother.
Yeah.
On you all the time, that the child is still hungry. No matter how long the child has been feeding. Yeah. Child's still hungry.
Yeah, and
still to this day.
And just like breastfeeding terms, like babies that are formula fed tend to hold out for a little bit longer.
Hey, they don't get
tend to, not always. I'm not saying that everyone is the same.
Yeah.
But they tend to hold out a little bit longer, and then babies that are breastfed usually feed more frequently because it's smaller amounts but more frequently. So there's like breastfeeding moms that literally feed sometimes 18 to 20 times a day. Oof. Because it's on demand.
Yeah.
And, and a lot of us like that are trained are used to saying, hey, yeah, you should be breastfeeding every like 2 to 3 hours. But truly, that is not how it works. Yeah. It is on demand. Yeah. So if your baby cries because they're hungry, after 30 minutes, you put them on the boob.
It's a lot of work.
Yeah.
It's a full-time job. Yeah. Honestly, breastfeeding is a full-time job. I don't care what anybody says, but it is. If you decide to do fully breastfeeding, like nursing. Straight to the nursing straight to the tit, it's a full-time job.
It is.
And I tried to get them like on these like stupid schedules of like the 2 to 3 hours, and all that. Dude, you know me. Yeah. You know that I'm type A. Yeah. So imagine me breastfeeding. Yeah. How the fuck was that gonna work? It wasn't, And then I'm so type A that my changing pad was a scale too.
Oh my God, Julia.
It was the Hatch scale. Do you remember it?
Yeah, the Hatch, yeah.
The Hatch scale. It's awesome, like it's great, but don't recommend for people like me with anxiety. Because every time I would weigh him before, and then I would weigh him after, so I could know
how much
I gave him.
Yeah.
Insane.
So for those of you that don't know, you can weigh a baby, and then that change in grams, you can convert that into ounces to see like how much, because the conversion is the same.
Yeah, and I did the damn thing. Because anxiety personified. That is me. Yeah. And postpartum, with everything going on, with your hormones going on and everything.
I totally get that.
My anxiety was even worse than it normally is. So it was a bad combination, but I was determined and I wanted to do it. And then talking about the hormones, those same hormones, like you need them for breastfeeding. Yeah. So it's a lot.
Yeah. I remember, and you're supposed to guide yourself because, so just a little bit of like medical, like knowledge. Yeah. You really start developing your colostrum way earlier on in pregnancy. So it's not like the colostrum just like develops like the day that you give birth.
I have that written somewhere down here because I didn't know that. I thought it happened like on the day that you're labor, like you're in labor type of thing.
So you're building that colostrum for weeks before.
That's really cool.
Like various weeks before. And there's actually women that harvest, quote unquote, their colostrum.
Yes.
And I did not know about that.
I did see
until
that.
later, like after.
Same.
So I was like, wow. So they have there's women that have syringes full of colostrum.
I am thinking of a mental image right now, and I'll post a photo on it because that mental image, I need to see it now because it's exactly what you're saying. Like syringes and colostrum, it doesn't look like normal milk.
No, it's
in no way.
It looks like a yellow, thick fluid.
Exactly. And did you know that, like, not humans, but obviously, but like for horses and other animals like that, they harvest colostrum and they sell it for a pretty damn fucking penny.
No way.
Yep. Yeah, like for these like thoroughbreds and stuff like that. Crazy. They sell it for like thousands of dollars, colostrum. Like, that's how important it is and all that stuff.
Wow.
Crazy. But anyway, talking about colostrum.
Yeah. So baby has colostrum. So a lot of women are like, no, like I don't have any milk. And it's like, you do, but it's like colostrum and it's not, it's like way more bang for your buck. So it's like a small amount, but it's extremely good for the baby. It has antibodies. It has like all these types of really good
heavy nutrition
that the baby should be getting. And that's why they called it liquid gold. So, but it's not until after, like maybe 3 to 5 days after that, you know, oops, I just hit my microphone. Sorry, guys. That you recover and then your body goes into the state of recovery and then you're able to like really drop your milk production.
Right.
And when I say drop, like the milk is like in your breast, like in your milk glands, and then it's able to be released to actually have a letdown. So, with Nora, I had plenty of colostrum. Oh my God. But every single time that lactation specialist, I don't know if they did the same thing for you, but every time that lactation consultant would have me manually express the colostrum.
No.
Oh my God. She would walk into the room and I was like, aquí viene esta vieja, darme la teta. Like,
no.
Oh my God, it was so painful. She would grab my boob and like literally milk out the colostrum. And I was already sore from breastfeeding.
Of course.
And pumping, because I started pumping right from the get-go.
Oh my God.
And I was like, every time she would come, she's like, hi. And I was like, oh. I was like, here comes pain.
No, thank God, no. Thank God,
Nora didn't pee. So, you know, they're supposed to pee within the first 24 hours.
Yeah, I remember
She did not pee. And I was just breastfeeding. And I was like...
So they're thinking, like, she needs more, like...
More, exactly. And I was fine. Like, I was like, oh, where's the damn formula? You know what I mean? Like, where is it?
Yeah. You're at this point, like, okay,
at this point,
fine.
I'm like, I just want to have her pee.
Yeah.
You know what I mean? Like, the rest we can deal with later.
Exactly.
But I just want to have her pee. And man, they gave me so much trouble until a nurse finally came at the end. And I was like, listen. It was a nighttime nurse. I was like, listen. It's been 24 hours.
Oh, God.
My baby has not peed.
Yeah.
I'm a pediatrician. And I'm like, she needs to pee. It is my choice. I want the damn formula. Exactly. And the nurse, I don't know if she was so scared. And she was like, of course it's your choice. I'll bring it right away.
It's probably that. Yeah. She was probably, oh, snap. This is going to be a complaint.
Before the neonatologist came. Also, Nora was something called Coombs positive. So she there was like well, we kind of talked about it in the blood transfusion episode that when you're born with a different blood type.
Oh, yes.
You can have this mixing and it kind of like hemolyzes what we say, which is like builds up and the bilirubin can go up. So in order to like get rid of the bilirubin, sometimes these kids have to be supplemented so the bili doesn't go up so high.
Oh, okay.
So I had the Coombs, I had the not peeing at 24 hours. I was like, this girl's belly is gonna like shoot up into the air. The neonatologist came down and I was like, dude, can we just have some formula? And she was like, no, you'll be fine. She'll pee, this and that. Dude. My God. Do you know what it is? To have a neonatologist come down and tell me that she's not going to give me formula?
I didn't expect that. I thought she was going to tell you, yeah, of course, let's just do it. Yeah, like...
I was like, aren't you busy? Like, what are you doing here talking to me about formula? Another physician. Like, a pediatrician, by the way. Maybe I was a radiologist.
Yeah,
that I didn't know anything about.
That's freaking...
I do this all the time.
That's freaking bonkers, man. I didn't know that. Damn. Jesus. Whatever.
So when you went home, you were like on a schedule?
Yeah, because again, anxiety and type A of it all, you know, horrible. The 10 out of 10 do not recommend. Like, I should have been more like, feed on demand or whatever. Because looking back on it now, that's the type of baby he was. Like, he probably would have wanted to just be on my boob like every hour, which is insane, you know, and that's something that maybe that's the thing. Like, if it wasn't painful, if he had a better latch and all those things, then maybe, sure, whatever. But since it was such a process for me to breastfeed him, I had to put the nipple guard on and the whole thing and a lot. I just had to do a lot. And
and you're not excited.
I'm not.
I remember it would be like time for Nora to feed, and I was like,
It hurt
I had to
less to
mentally
pump.
I had to mentally prep myself for the pain and that I was gonna hate it. And I honestly, it came to a point where I was like, no, I have to stop because I started to hate breastfeeding.
That's it. And a lot of people don't warn you on like the psychological effects of all of this, about having problems with breastfeeding and all that. They just, and I get it. Encouraging breastfeeding is important. Breastfeeding is very good for you and the baby, all those things. That's great. And we're going to talk about the benefits of it. But like, still, if you're seeing that the mom is having a negative impact on her mental health because of breastfeeding, that kind of outweighs the benefits in my opinion, because it's like it's going to affect the bonding. Her mental health is very paramount postpartum because there's so much going on already as it is, that you need to be in a good mental state, and if it's not helping you be in that good mental state, then formula might be the best way, or supplement. You could do a little bit of both, which is what I ended up doing, and it saved my life. Once I included formula with my breast milk, game changer. Game changer. Amazing.
And MR had like a lot of reflux too, and all of that. Oh my God. It was not easy for you.
It was not. Probably that's why, one of the many reasons of why he's an only child. That first year, I swear to God, what is still a blur. Like, there's bits and pieces of it that I remember, but I don't even remember that much because he was such a difficult baby to just feed overall, not even breastfeed, feed overall. It's just, he was a very finicky baby. Hard. And I remember all the times that you would visit us from Tampa and whatever, and like, remember that time that you came over to the apartment? We were still living in the apartment, and you saw me like struggle breastfeeding him, and I was like, if I didn't cry, I was on the verge of crying.
Right, yeah.
And you're there like trying to comfort me, like, you're fine. He's fine. Look at him. He's fat. Yeah. And I'm like, no, he's going to waste away. And I'm like, and Evie was like, Julie, open your eyes. He looks healthy.
I felt so bad.
I was beyond myself, dude. I was beyond myself. Yeah, that's probably why he's an only child right now.
But the thing is that's like the thing. It's like you lose so much sleep just with breastfeeding.
Holy cow, that's the other thing.
Yeah, you lose so much sleep.
So little sleep.
So when someone comes, I'm not saying me, but like, I've had like other people in clinic come in. It's like, oh, like my family is just telling me to just like, give them formula, and I've worked so hard in breastfeeding. I'm like, oh my God. Like, if someone's, like, successfully breastfeeding and then someone just comes and, like, gives the baby, like, a bottle and just, like, shits on all your hard work.
But, yeah, I'd take offense.
I would take offense. That'd be like if someone was, like, telling me to fuck off.
Exactly. Yeah. Yeah, I 100% agree. But going back on colostrum, since I do have a little bit of notes on it, like, I have here that colostrum is the earliest breast milk produced, like you had said, and as you just said, beginning mid-pregnancy, about 12 to 18 weeks into pregnancy, and it's continually produced. And it's called liquid gold, and it's that yellowish color. It doesn't look like regular
Good
milk.
for your immune system, decreases a lot of like infection risk at the like when the baby's a little bit older.
Yep. And like you said, the immune system, so you get like, baby gets like your antibodies and, white blood cells, all that stuff for the immune system. And then it's also a tough coating on the baby's stomach and intestines.
Yes.
Which is part of the immune system part. And then acts as a laxative to help your baby pass the meconium. So what's meconium?
Meconium is the first poop. So it's that really dark, sticky, black poop that's like so hard to get off. It's like the first ones.
Okay.
So since it's so sticky, that kind of helps with it to like get expelled.
Yeah. And then the colostrum also helps with jaundice, which is one of the main reasons why like I really was into like the whole breastfeeding thing in the beginning, because my baby was jaundiced.
Yeah.
So they told me, keep breastfeeding him and that'll get better. And it did. Like eventually, like, I think maybe a week or two later, like it was.
Yeah. So the more you breastfeed, it's not just breastfeeding, but like feeding in general. So the way that jaundice is eliminated is through the urine and through the stool, which is the poop. So basically, the more you feed, the more they have that oral colic reflex, the more they poop, the more they pee, and all of that. So it's basically like improving the jaundice.
Right. Okay. And then saying how how much of it, like we were talking about in the beginning, babies have tiny, tiny, tiny stomachs.
Yeah,
you
like
know?
a marble.
Exactly.
It's
They
the
have
size of a marble.
tiny stomachs.
So when my mom was telling me, ay, la niña, mira, se va a tomar 3, 4 onzas, súbele las onzas, ella quiere más, mira, y ve, tiene hambre, se quedó con hambre, and this and that. My baby was like 2 weeks old, drinking 4 ounces of milk, and here I am, like, pumping, trying to keep up with the demand.
Same.
And all these, it was...
I even took, like, supplements to, like, increase my demand.
I never ended up taking the supplements.
Oof, I did everything.
Not because of anything. I ordered them. And they're expensive as fuck.
Super fucking expensive.
Yeah. So it was like my mom constantly pressuring me of like the baby's not eating enough, and I don't know if MR has
copy and paste over here. My mom was the same.
Oh, yeah, our moms are the same person.
The same.
Yeah,
exactly the same.
Our moms are the same person. So
the anxiety and all that. Like,
did you have the anxiety also about the tongue tie?
Mm-hmm.
Did you ever get it corrected? Mm-mm. I got Nora's corrected, and I can just say, and I'm not saying this is everyone's same situation. But it's one of the biggest things that I regret for Nora.
Really?
Yes.
Because I didn't do it. I was up to doing it because I'm like, if it helps with his latch, which means that it helps with his feeding, which means he'll feed more, which means, all these domino effects. I was like, okay, I'm down. Let's do it.
Yeah.
But then at the end, when I was really considering on doing it, that I had even spoken to her pediatrician about it, and she was a little like, not really, like whatever. So then I brought it up to Mario, and I'm like, Mario, what do you think? And he's like, no.
Yeah.
And I'm like, why? He's like, no, not necessary. For that, we go to formula. And Mario was like, from day one, like, this is too hard.
Yeah.
Fuck it.
Yeah.
Like, sincerely, fuck it. And it was me the whole time.
Yeah.
The whole time, like, no. Again, the determination thing and the whole, like, when something gets in my brain, like, I go with 0 to 100.
Yep.
So that was me breastfeeding, 0 to a fucking 100. And I was like, absolutely fucking not. But then I didn't do it. I think I still have a tongue tie.
No, girl, you're fine.
No,
but that's normal.
Oh, okay.
Tongue tie is like at the front.
Like in the front.
In the front, yeah.
Yeah. I need to check his tongue now.
You don't even have a frenulum. I think I have a frenulum.
What's a frenulum?
You don't have one.
Really?
Yeah.
I thought I had one.
Like.
Oh yeah,
sorry.
no.
You don't have one.
Okay, we're posting that too.
See?
Oh, so like the little white thing in the middle.
This thing right here. This thing.
That. Okay.
So
I could have sworn that I had one.
Yeah, but like babies that have
Jesus, I don't even know my own tongue.
Babies that have tongue tie, it's like
all the way in the front.
Like all the way in the front. Mm-hmm. So Nora had a tongue tie. But okay, the thing about the tongue tie.
Let's start from the beginning.
The tongue tie is it does affect latch to some degree. Mm-hmm. Okay. And a lot of lactation consultants will talk about the tongue tie.
Yes, I know.
Okay.
They talk to me too about it.
However, I think the thing that it's like this constant battle, and I know that people out there will understand what I'm saying, because it's like when you say your pediatrician was like, maybe not.
She really was. Like, she was like...
And my pediatrician, I'm a pediatrician.
Yeah.
Okay? And I was so, like, lost in the world of latch and tongue tie that I was like, maybe she really does need this. You know what I mean?
Exactly. You said it perfectly. Lost in the world of it. Because when you start, like, oh my God, how can I make this better for my child?
You're not thinking. You're just like, I just want to do what's best for my baby.
100%.
And then, so I even told my pediatrician, he's an old pediatrician. Like, he was my pediatrician. So he was like, absolutely not. He's like, I don't even need to see you. I'm like, it's...
Oh, really?
Yeah. He's like, I've never seen a tongue tie.
So then who did it for
No. So then I did it with her dentist.
Oh.
Her dentist did it.
Okay.
So I was like, you know what? And let me tell you, I think that was wrong in a sense of my pediatrician to at least not check.
Okay.
You know?
Yeah.
It's like, at least give me the fucking peace of mind that you checked.
Yeah.
And so he didn't check. So I was like, you know what? I'm going to have someone else check. And I went to the dentist, and I was a little bit more calm because I was pumping and like still trying to latch and stuff like that. But she was fine. She was gaining weight, and I didn't feel so pressured. And I asked the dentist, and he was like, no, she does. Like, she does have a tongue tie. And then he was like, if it were my baby, he was like, I would laser it off. And then I was like, I feel like when the doctor tells you, like, if it was his baby.
Absolutely, yeah.
So I did it. But you know what? I regret it.
Why?
I regret it because it was like, I feel like when they tell you that it's just a laser, and I'm not saying that he didn't advise me. He did. He was like, I will laser this. However, if you do not do the exercises after the laser treatment, which is like stretching her tongue and stretching that so it doesn't scar back down.
Oh, God, poor thing. Yeah.
Yes. He's like, if you don't do this, it will not work. It's like if I didn't do it. And then I was like, no, I'm going to do it, right? So he lasers it. Honestly, it took him longer to take Nora to the room than to bring her back. Yeah. She actually did have a better latch from what I remember. She did have a better latch because he had me immediately like latch her on.
Damn.
Yeah, like immediately. So he immediately latched her on, and then at home, her lips were so swollen from the laser.
Oof.
And I had to do those exercises 4 times a day.
Oh no.
So with olive oil, I had to go and with my finger rub that so that it would keep stretching and stretching so that the tissue wouldn't scar back down. I had to do that 4 times a day. And she cried so much, and I know that she was in pain. She cried so much, even when I gave her Tylenol. She cried so much that I started crying. And my parents are like, what's wrong? She's fine. And I'm like, I can't believe I did this to her. This was not necessary. And truly, this is just my opinion, I don't think it's necessary. And like I did like a lot of reading and stuff. And in my residency, we had a oral, like a maxillofacial surgeon that we would do a lot of rotations with. She was amazing, and she actually conducted a study on like how like the incidence of like what, you know, or like basically how associated was a tongue tie with actual like problems in breastfeeding. Yeah. And it really wasn't like a high association. Huh. Okay. Yeah. So
I wonder how it even became like a thing. You know?
So don't get me wrong, there are kids that are like truly like really bad tongue tie, and you know, and
but maybe
they have trouble like gaining weight, and
maybe if it becomes like
they can't even grab a bottle. You know, they can't even grab a bottle.
Yeah.
So you know, I do think that there's probably kids that need it, but to be honest, like,
but for the run of the mill,
and like the frenulum is such a thin tissue that it's gonna stretch. Yeah. You know what I mean?
You're right, yeah.
They just need to, like, use it, right? So there's no way that you can expect the frenulum to stretch in the first, like, week and a half to 2 weeks.
Right.
So for me, that's, like, one of the things that I truly regret with Nora. It was doing that to her because I truly don't think that it was, after I did it, I was like, this was not necessary. It was not necessary.
But, dude, like, you're a first-time mom.
Yeah.
You know? There's so much going on. Mm-hmm. You're also a single mom.
Yeah.
You know, which we need to talk, like that needs to be included in your experience, because that is a different experience.
Yeah, I was.
Being a single mom versus, like, for instance, me, that I had my husband. Back then, my mom wasn't living with us yet.
Yeah. No, I had the help of my parents.
Yeah. Your parents, invaluable. Like, of course.
I don't know what I would have done without them.
100%. But, like, still.
Yeah.
It's different, you know, your parents versus your significant other, husband, whatever, whatever the situation is. Just your partner. Without your partner, it's different. It's just a different experience, you know? And it could be good, it could be bad, or whatever. Yeah. But, like...
And for everyone out there, like, I don't regret it either. Like, I'm fine, you know?
Oh, no.
Like, it was a good thing.
No, you killed it.
It was a good thing that...
Yeah, it happened that way. That's a personal thing.
Yeah.
We don't need to talk about that. But it's just everybody has their different life situations. Yeah, you know? And your situation was different from mine because you were a single mom. You only got the help from your parents versus me. I got the help from my partner, my husband.
Yeah.
And my parents. But my parents didn't live with me. I only lived with my husband. Mm-hmm. And I was lucky enough that he was in medical school. He was trained for this type of stuff, very, you know, literate in this type of situation versus like anybody else, like most people out there, they're also like in the same boat as a mom that they're like, I don't know how to help you here, you know, type of thing. Yeah. So breastfeeding is a lot. Like the point of this episode is that breastfeeding is not just put baby on boob and go. No. Not that at all.
No, at all. It's so complex.
There's a lot to it.
Do you want to like go into like some of the tools that you used for breastfeeding?
Yes.
So nipple shields, what are they since you used them?
Okay, so if you're on Patreon, you'll see the recorded episode of this, and you'll see me touching my boob. So here it is. Anyway, but and of course I'll post it on Instagram and our socials, photos of all the things that we talk about and whatnot. But anyway, so it's literally a shield.
Yeah.
And it's shaped like your nipple. So and you're supposed to like kind of like wet it a little bit.
Yeah, so it like sticks
so
on.
it sticks onto your nipple.
It's like a silicone.
Exactly. It's a silicone. Like some of them are a little harder than others, and it's a clear silicone type of thing. And some of them are like half moon shaped. Some of them are full, like full circular, and then it's shaped to your nipple. And it comes in different sizes. So you're supposed to like measure or like get a few of them and see like which one fits your nipple best.
That was the hardest thing for me was measuring your nipples.
Hard. It was hard.
I was like, for me too. When they told, because I did it not for the nipple shield, I did it for the breast pump.
Yeah,
you have to measure your your nipples.
And a lot of breast pumps come with different attachments that you're supposed to.
And you should have seen me trying to measure my nipple. I was like, wait, is that? What am I doing?
Oh yeah.
There's like little like things that you can download online and print them, and it's like a true to scale.
Yep.
I was so lost.
There's a lot.
I felt like I was doing math.
Yep.
In my brain, I was like, wait, so is this?
I don't have the mental capacity to deal with this right now.
Exactly.
But anyway, so you grab it, you wet like the surrounding like circular area of like the nipple, like around the nipple part where your nipple would go in. And then you like flip it back. And then with that wetness, you put it on your nipple. Here's my boob. So you put it back, and then that creates like kind of a suction. So then in the tip of the nipple, it has like maybe 3 or a few, depends on what brand you use or whatever, little holes. So then the breast milk could come out.
Yeah.
So you need that suction so it stays as close as possible to your nipple.
Yeah.
So then the milk could just stream out of it without causing too much gas, because that's the last thing you freaking want.
Yes.
You don't want a newborn with gas.
No.
So you're trying to like create the best suction possible, and that's why you got to measure it, make sure that it's as tight as possible around your nipple to create as little gas as possible.
So when they're
thinking
about this as like, this is like, as I'm remembering breastfeeding, and it's like this shit that
I'm getting hot again.
Yeah, it's this shit. You're so tired too.
You're
so exhausted, and you're like, get the nipple shield, wash the nipple shield, put it on.
That's the other thing. You got to sterilize that all the time, because again, it's breast milk. Okay. There's a lot. It's breast milk and saliva and everything happening. You got to like clean everything, sterilize everything. There's so much work.
There's so much work.
So much work. It's just, I'm sorry. It's not as easy as everybody.
No, at all. So, okay. So you used that. What else did you use? Did you ever try manually pumping?
Yes. Well.
Oh my God. Here we go. Yo, listen, manually pumping is a science. I did not know about like the difference, like when the baby first suckles, that's like the stim, and then when the milk drops, it's a letdown.
I don't think I ever told you this story.
Oh wait, tell me. This is gonna be good.
I'm glad we're recording this on video. So anyway, we went to a wedding, right? And I had just made the decision to stop breastfeeding, and I was no longer like giving my son breast milk anymore. I was already like maybe under a week. Let's say under a week.
Yeah,
I'm not
he
sure.
was older.
Well, yeah. So
you breastfed for a long time.
Yeah, because after that, like after maybe 3 to 4 months of doing it like to the boob, I just transferred over to pumping, and then I did that maybe for a month or so or whatever, and then just cut it.
Yeah.
We're talking about like that time that I just cut it.
Yeah.
Because then he was developing all this like eczema and stuff. We didn't know what was happening from it.
Protein allergy.
Yeah, and like, I mean, the pediatrician said it wasn't that, because he wasn't he didn't have like blood in his stool or other things like that, but maybe.
Yeah. But no, but eczema can be a sign of protein.
So at the end of it, what she told me was like, listen, if you want to keep on breastfeeding, you're gonna have to do an elimination diet. And I'm like, I'm a picky eater. Yeah. I mean, I almost threw.
But it's just milk. Right?
I almost
like dairy.
Well, no.
What did
the one that she told me? Well, I almost threw up on the last Patreon episode thinking about jackfruit. Okay. Exactly. So I'm a picky eater.
Yeah.
Like I gagged when you were talking about how to prepare that jackfruit. Yeah. Anyway, 100 Patreons, you're gonna see me doing it on video.
Yeah,
if we reach
on Patreon,
if we reach 100, and now I'm saying it out to the world with no paywall. So here it is. Anyway, and I'll do it. But anyway, so it's strict elimination. Like I would have to eliminate all dairy, all like artificial dyes, all soy. And if you start looking at soy, like what things contain soy, everything,
yeah,
everything contains soy.
Why did she make you do that?
Well, she's like, a true elimination diet is that. And when I looked it up online, she wasn't wrong. Like, you look up elimination diet for breastfeeding, it is intense.
Yeah.
So I'm like, I don't know, I'll think about it. She's like, listen, it's very strict, I don't recommend it, but if this is what you want to do, if you really want to continue breastfeeding, then this is it. You have to start like this, and then slowly start reintroducing
I've never
foods.
recommended an elimination diet.
And then slowly reintroduce foods to figure out what's causing him the eczema. And I'm like, bro, like, okay, whatever. But I, in my 0 to 100 mentality, I'm like, let me do some research on this. Let me figure it out. I bring it up tomorrow, that day when he comes back from work. I'm like, listen, this is going. He's like, nope, done. You're done. You're done. It ends here. We're done. No more breastfeeding. And I'm like, listen, I could do it. He's like, no. He's like, your anxiety is already through the roof. And on top of that, you're a picky eater. This is not going to happen. This is not going to happen. Like,
oh my God.
And this ends here. So, and he was right. Like, I took a day or whatever to like think about it. And then every time I would have to like put the little like eczema cream on his face and all that, I'm like, you know what? I'm done. Like, we're torturing the both of us for no good reason. Like, I'm over it. So going back to the story, it was during that time that I cut it, and I didn't even give him any pumped breast milk or anything because I'm like, I don't know, what I'm eating that's causing this. So done. But once you're done breastfeeding, it just doesn't stop. You have to, your body takes a little bit to like determine that you're no longer breastfeeding so it can stop producing it. So I was in that week or whatever.
Oh my God.
And I'm still producing a lot because remember, I was taking supplements and everything.
Yeah.
So I was producing a lot. And then by the time that we got to the wedding reception, I was in the bathroom and my tits were rock solid.
And that is like the worst pain ever.
It hurts so bad. So bad. I was like, holy shit, like this hurts so bad. Yeah. And I'm without a pump or anything at that point because I'm no longer like pumping for him or anything like that. And I'm like, I'm gonna have to milk myself like a cow. I'm gonna have to do this.
To express yourself.
I have to. I have to. It's either that or we immediately go home, and that wasn't gonna happen because we were in BFE Homestead. Yeah. For those of you that don't live in Miami, Homestead's like far from like main Miami. It's like south from us. It's like farmland. And it's far from Miami, like minimum 45 minutes. Dude, horrible. So I'm like, there I went. I lifted up my dress. Thank God it was a short dress. And I started manually expressing myself onto the sink.
On the sink?
On the sink.
Oh my God. Oh my God. Were you like in a private bathroom?
Yeah. Thank God.
Oh, thank God.
Oh, thank God. No.
If they tell me to wash my hands, I'd be like, oh my God, what did I just walk into? Can you imagine the small talk? Just casually coming in to wash my hands to someone manually expressing.
No, dude, no. Thank
Here
God.
I am, like, no, we need to normalize breastfeeding. And I'm out here like, I would not want to do.
And you're like, ma'am.
Madam,
what
are we doing here?
What's happening?
Oh my God.
Do you need me to call someone for you?
Yeah, I know. Should I buy you a pump? Like, oh my God.
I was like that, and then I learned how to like, you gotta grip it, like grip your nipple,
grip the actual nipple,
in a certain way.
Not the tip, like the actual.
No, it's like the back,
the areola.
Exactly, and you gotta like literally like a cow.
You have to like pull forward and down. Yes, it's literally.
It's like a whole fucking thing, and there I was.
Oh my God.
That was me. Like just manually expressing both boobs because they were both like that, and it took me like a good amount of time because it's not like always that you can't just, even if you've done it a million times, you can't just like, at least in my experience, you can't just grip it and go no. It's just like you gotta grips, and that was me. In the bathroom, in the fucking bathroom. And then I felt bad. And no, I cleaned everything. Like the water was running while I was doing that the whole time. And I was like aiming it to to go straight down because I'm like, this is fucking horrible. Like, how am I doing this right now? And I'm like, they're like aiming to, girl, the thoughts that went through my mind.
Oh my God.
The thoughts that went through my mind. I'm like, how is this real? How is this happening to me? But anyway, and then since it was like one of those private bathrooms, like I looked under thank God there was like a little drawer underneath.
Yeah.
And they had like, Lysol and shit like that or whatever.
Yeah.
So then after I was done and put myself away, like I started like spraying everything. And I'm like, I swear to God, like I'm cleaning too. Like I feel so bad. Like
on a wedding.
Yeah.
And where's Mario? Mario's like, where's Julia?
Yeah, well, that's what happened. Like after I even cleaned up after myself, like of course I didn't make a mess, but still I felt like I needed to sterilize,
Yeah.
And mind you, nobody knew I was doing this in there, but still in my mind, I'm like, let me not be a shit person.
Can you imagine someone knocks on the bathroom door and they're like, knock, knock, and you're like, I'm expressing myself.
Well, they did because it took me forever. So that I'm like, busy. Like, you don't want to see this.
Oh my God.
Go to the next one. Sorry.
Oh my God.
So I came back and Mario was like, hanging out with his friends or whatever. And he's like, what happened? I'm like, I had to milk myself like a cow. And I just looked out blankly like, I milked myself like a cow.
Lord.
That happens. Yeah.
Oh my God, Julie.
It's one of our friends' wedding. Like it. You weren't there. You were in Tampa then. But I won't mention her name because, she would probably, like, I don't even know what she'd do. I'll tell you off air. Mostly her. Like, I don't even know. But anyways. So colostrum. Oh my God.
No, not colostrum. Well, we're in the tools of pumping.
Oh, the tools of pumping. Okay.
Yeah. So you actually, when I said manually, like the manual pump, you actually like manually pumped yourself. I was talking about the one that you like squeeze.
Oh, I had one of those too, but that one, it was better off me just like.
So I was like looking up the instruction and they're like, okay, so, if you want to manually pump the first minute until you start like dripping drops or having drops of milk, you have to go fast because the baby sucks really fast at the beginning. So here I am, I'm like, fast. And then I finally start seeing like drops of milk. And then they're like, you need to then slow down.
Right. It's a whole rhythm thing. I'm like,
yeah, it's a whole rhythm thing. This you need to slow down when it starts like actually like it's more of a stream.
Yeah.
Right.
Yeah.
So then I'm over here, I'm like, fast. And then I see a stream, and then but it's like a pump. And so I'm like looking over my boob, and I'm like, is it streaming? Is it not?
Yeah.
And then I like go to slow, and then I don't see anything coming out, and I'm like, what the fuck is going on?
Too much.
It's too much. So then pumps have that too. They have the stimulation setting,
right?
And then they have the express mode,
the electronic ones.
Yeah.
Swore by that.
Yeah. Okay.
I swore by the electronic ones.
But let me tell you something. I think a lot of my friends know me about like this part of me. I consider myself like somewhat of a feminist, but this is not anything to do with like feminism, but maybe a little bit.
Okay.
But I cannot believe that in this world where we are sending people to the bottom of the freaking Titanic to go see, okay? We're sending people to the moon.
Yep.
All right?
Yeah.
How it is possible that electric pumps that are not cord,
yep,
like you're not attached to a pump, like as in like you are sitting down pumping. I don't know how it is not available for every women out there, every woman.
Yeah, agreed.
Okay?
100%.
To not just have the in-bra, like, pumps.
It makes no sense.
I'm like, do you know what it is to sit every 2 to 3 hours to pump
with a massive machine?
It's not. I don't want to say it's like massive. I think it's like pretty.
No, but it's like the size of this.
It's the bottles. It's the special shirt you need to wear.
Like it's the size of this thing right here, and I'm holding our microphones like cover, and it's like the size of like let's say
and then
what is this?
Some women are
like 6 by 6. Like
there's one that's like battery powered, but you're still connected to a tube.
Yeah,
and I'm like, what are you doing?
And the ones that are connected to the wall, like the Spectra 2, which is the one that I had, it's electronically connected to the wall, and then you go have the tubing.
Yes.
To, the air tubing
Exactly.
to expel the milk on that, and then that is attached to like these bottles
to the flange.
The flange is attached to the bottle. It makes no sense.
And you one wrong move and all your hard work spills out.
Gone because that's the other thing.
And I'll cry.
Yeah.
When they say don't cry over spilled
you
milk,
cry over spilled breast milk, and I did.
Yeah.
I lost a whole 8 ounces one day.
Oh my God. I just got stabbed in the heart with that.
I have goosebumps thinking about that day. That was a dark day.
Oh
that was a
moment of silence for the spilled 8 ounces of milk.
That was a very dark day for me. But anyway, and then I got back then, like one of the first ones, I think Evie had LV.
Yeah,
Evie.
that's the one that I had.
Okay. Yeah. But I had the Willow.
Yeah.
So
it's either Willow or LV.
That's
and then there's Mom Cozy or something like
but
that.
But it's fucking bullshit that the insurance covers the Spectra 2 and all the big fucking ginormous ones, of course.
Yeah.
But then the ones that are more practical that you could actually have a life with.
Yeah, you literally just put it in your bra.
In your bra. Yes. You look like you have like these.
It doesn't matter though. You're not connected to anything. And with a Willow, you can. There's like their whole entire commercial is like a lady doing yoga.
You could do whatever, and it's just a.
Yep, that's exactly what it sounds like. Actually,
girl. I know.
I have the LV. With the LV, I don't think you can tip over so much because it'll leak. So the LV is not leak proof. But I had a great there was never like really a time where I was like bent over, but it was like nice to just be able to stand up, go wash my hands, fold some clothes, sit down, carry Nora when I had to put something,
do some dishes, sterilize some bottles.
Exactly,
dude. The million things you have to do when you're a mom.
Yeah.
So it's like how do you
breastfeeding
and a breastfeeding mom.
I was a slave to that pump.
Me too.
Let me tell you, I used if there was anything. Well, I usually tell this to people when they're like, oh, I'm pumping, and I'm like, I talk to them about what kind of pump they're using.
Yeah.
And they're like, do you recommend the wireless pumps? Mm-hmm. And the only thing I will say is that sometimes the wireless pumps don't have like enough ability to customize your breast expression.
Okay.
So with the Spectra, you can actually program like 2 minutes of this, 3 minutes of that.
I did love my Spectra too, but I wish it was wireless.
Yeah, exactly. So you with the LV and the Willow, they have like already set settings. Yeah. Good settings.
And it was even like through the phone, like Bluetooth type of thing.
And it measures, it wasn't so accurate, but sometimes it measures your ounces and stuff.
Yep.
But whatever. Point is that
but we had to pay for that out of pocket. Which is fucking bullshit.
My insurance.
I don't know if it's different now. Hopefully it is.
My insurance. Well, I know some people that their insurance is covering it completely, either Willow or LV. So I'm really happy.
They should.
But for me, they only covered half of it.
Zip. 5 years ago, nothing. It was either the Medela one or Medela, whatever, or the Spectra. I had only to pick between those two, and the two of them were the typical wall ones.
I wanted like one of the ones that was like the wall because a lot of people said that they were so good.
It did. In comparison to the Willow, again, this was 5 years ago. So those breast pumps, I know all of them have changed and they've gotten better like from 5 years ago because I've seen it like online and whatever. But back then, 5 years ago, the Spectra 2 pumped the shit out of my tits. Like I got a much better output through there. But the Willow gave me freedom. You know?
Which,
so
honestly, it's just
like how I ended up doing it, like the schedule that I ended up doing was right in the morning when I would wake up, which was my highest output, I would use the Spectra 2 to get as much out as possible from that higher output. Then during the day, I would use the Willow because it's just during the day. Yeah. And then at night, like I would give myself like a good amount of hours before like I put him to bed and whatever. And then I would do the Spectra, the wall one all over again to like give me. And then in the middle of the night, again with the Spectra too, because that's another thing. Even if you're pumping, you got to wake up in the middle of the night. You can't have a solid 8 hour sleep. And that's not going to happen with a newborn, but still like.
And because of the hormones, you actually have your best output in the middle of the night. Mm-hmm. Mm-hmm. So that like 2 a.m. pump sesh, I would get a lot out. A lot.
Same. I think that 8 ounces happened then because I was like more asleep than awake.
Yeah. Oh my God.
Yeah.
And like
so, a lot of things.
Waking up to pump. Oh man.
Waking up to
just anything pumping. Every time I had to see that pump, I was like, here we go.
Yeah.
Again. And then I would think to myself, I'm like, it's only like.
It made me feel.
Only like 3 months. I'm like, I have a long
It
time.
made me feel like a certain way too. Not a good thing. Not in a good way. Like it just made me feel like,
Yeah, you're just being used.
yeah, like
Yeah.
I'm a, like,
Like a cow.
yeah,
You're just a cow.
like
being
I'm
used
just
for
like,
milk.
I don't know. It was just, it wasn't great. It wasn't great.
Yeah.
But yeah, so the other thing that I had to touch upon before we close out the episode is about how milk, breast milk, kind of tends to change, and then like how it changes to help with like if your baby gets sick or you get sick, like
Yeah.
how it changes to that too. So you got a lot of knowledge with that.
Oh my
Mostly
God.
being a pediatrician.
No, well, now that you just said that, like how
Yeah.
it like helps when you're sick and stuff, but
Yeah.
like there's like a lot, like breast milk is considered to be like anti-inflammatory, antibacterial, antifungal, all these
There's
things.
a lot of crazy shit out there using breast milk.
Yo, there's some people
lot
that
of
would
crazy
come into
shit.
clinic and they were like, oh, the baby's eye was having some like secretions and I put some breast milk in the eyeball. And when I was a resident, I was like, what the
Jesus Christ.
Yeah.
That doesn't sound like a good
And then
idea.
like
I don't
some
care.
parents
I
that
don't
would
care how
like, they
special
would
it
say
is.
that like they're like, oh, they're concerned about an ear infection and they would put breast milk in the ear. Yes. And then
it just sounds unsanitary.
so actually, Nora had like really bad neonatal acne, like really, 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 really bad. And there were people that were like, you should put breast milk on it. And I was like, fuck it.
Why
I'm gonna
not?
do it.
Yeah,
And
why
I
not?
was like, yeah, it's not a steroid because the other option was to be like a little bit of a steroid, but it's not necessary. Neonatal acne is gonna go away on its own.
Right.
So I put like a little cotton ball with my breast milk. Bro, can you believe that the next day that shit was gone?
Nice.
I was
nice.
blown away. But again, like I'm not saying I don't recommend that.
No.
Okay, I do not recommend things that aren't like have like research backed up into
Right.
it. This was like my mini research.
No,
you
but
know?
there is some research out there about like how special breast
Yeah,
milk
breast
is
milk,
and
yeah.
how and people are studying it and like how it could help or like how it could be used in different things. You
Well,
know? So
I
it's
know,
pretty cool,
I
you
know a lot more people than you think that did the whole entire like well, not wet nursing per se. Do you know like wet nursing?
Like
what
somebody
nurse
else.
is? Yeah.
Yeah.
So
Somebody else feeding your baby.
someone
like
else feeding
nursing
your baby.
baby.
So I know a lot of people that weren't able to get the COVID vaccine. And some
Ooh,
others
okay.
that were
Okay.
or that had COVID, so they had antibodies.
Yeah.
So they would feed the other person's breast milk to their kids.
I did hear about that.
Yeah. And
So
it's
then-
actually extremely common.
Yeah.
Like people don't say it because obviously it's not something that like I feel like people are like, oh, I'm not gonna tell anyone. You know?
Yeah.
But when you actually dive into that world, there's a lot of people. Doing it.
Absolutely. I agree. And I had actually here in my notes about like how because some people are like, no, somebody else shouldn't breastfeed your baby for you, which is true. Like,
Well, no, because there's a lot of diseases.
Exactly.
that
And that's
you
what I was
pass
gonna-
through breast milk.
that's what I was
and
gonna say. Yeah.
I do not recommend that you're feeding from someone else.
Yeah, no.
Now, if you trust that person fully,
Yeah. That's your decision.
that is your decision.
Yeah.
Exactly.
Yeah.
But if someone were to like ask me like, hey, do you recommend I take someone else's breast milk? I'm gonna be like, nope.
Yeah, like I have here, for instance, let me see, has not been shown to lead to, okay. Because human breast milk has been implicated in transmitting HIV from mother to infant, that's a precaution you got to take. And
Yeah.
it's true. Like, so if you do that route, make sure it's somebody that somebody that's completely vetted, and all that stuff, and that's your choice completely. And I know that. And I know it's hard, and that's all we've been talking about this whole episode of how hard breastfeeding is.
Yeah,
And there are banks out there, but these banks like test the milk for all these things, so it's different. But, just at the end of it, fed is best.
Yeah, fed is best.
So
100%. I know there's gonna be a lot of people out there that are gonna be like, breast is best.
I mean, it's just hard because like even here,
I think if everyone had the option to easily breastfeed,
Yeah.
okay, or easily express milk, I think anyone would make that decision to be like, okay, I'm gonna breastfeed, But I think we also need to accept the fact that not everyone's breastfeeding journey is the same. Some are shorter, some are longer, some are more anxious, some are less anxious, some are more natural, some are more unnatural.
Yeah.
Unfortunately, there are some that cannot breastfeed at all.
Yeah.
You know?
Exactly.
And that could be from mom, or that could be from baby. There's babies that cannot breastfeed physically, like anatomy, and you know they have to have feeding tubes and stuff like that. Exactly. So I always say like feeding your baby comes in many different types of pictures, and you do what you think is best for your baby.
Absolutely.
Period.
And the other side of the coin too is what's best for your baby is also coincides and correlates with what's best for you.
Yeah.
You know, you and your baby, especially in the first year of birth, you guys are together.
Yep.
You know, there's a lot, your lives are just like this, like commingled, you know? So you have to do your own self-care. You gotta evaluate yourself too, because it's important for the baby, for you to be good too, you know? And like talking about how much work breastfeeding is, pumping and all that, there's a whole friggin' science on like, also because I had to live with that too. When I was just pumping, when I switched over to pumping with him, the storage of breast milk, you gotta store that thing. You can't just like, okay, I'm pumping it and that's it. Oh my God, cleaning the stupid pump parts.
There were so many parts to that stupid pump.
And every time you pump, which is so multiple times.
It's been like more greater than a year, almost 2 years since I stopped. No, it hasn't been 2 years. It's been greater than a year since I stopped pumping. And I still remember, it was the plastic base, the plastic tapita that goes on top.
Yep.
The silicone part that goes on top of that.
Yeah.
The flange that I had to clean. And then, like, you don't have to clean, like, the motor, but some milk will eventually, like, touch the motor. So you have to clean the motor, too.
Yeah.
And then there was, like, something, like a silicone piece on top of the flange, too, that would, like, be able to, like, have that suction.
So annoying. And everything about it is annoying.
And people are pumping. We recommend to pump at least 8 times a day.
So you're doing all of that 8 times a day minimum.
So I do not recommend this, but I'm always, like, honest. I actually did not clean my pump parts after every single breastfeeding session. The reason why, I'm telling you, I'm not like trying to be like a gross person, but the reason why is because in theory, breast milk is antibacterial, antimicrobial, and all of that, right? So I got like a very big glass Pyrex bowl.
Okay.
And then all of my breast like pump parts, whatever touched breast milk would go straight into the glass container and into the refrigerator.
Oh, so you refrigerate it?
Yes, I would I always refrigerated it.
Okay.
So I would refrigerate it because in refrigeration, you're not, since it's antibacterial, you're not touching it with anything else. You're not contaminating the field.
Right, basically. And then refrigerating it, you're also stopping the growth of any
bacteria.
Of any potential bacteria growth.
Exactly. So I would keep it, and then literally, as gross as it sounds, I would put those same ones when I was ready to pump again. I would put those same ones on.
I'm like,
and then at nighttime,
too much now.
I know, but then at nighttime, I would just clean it once. And I promise you, I think that's what saved my breastfeeding journey, because I cannot imagine cleaning my parts 8 times a day.
No, absolutely not. And
I don't recommend that, because it's actually not, like there's no studies to prove that. There's no studies to prove like how much bacteria like grows in the refrigerator and stuff like that. It's just in theory. It worked for me. I'm not saying it will work for anyone else. And trust me, like I lived with that every single day. I was like, oh my God, like, am I doing the right thing? And all this stuff. But that's what I did. I was very careful to not contaminate. I was very careful to keep everything very clean. Yeah. Wash my hands literally if I was ever touching anything. So, but it just like shows like how much like thought and work goes into this.
A lot. And then when you have the breast milk, because that's
what did Barville say?
About what? About what
like
part?
The pump parts.
He would like, every time he see me do that, he was just like, I can't with this. Yeah. Like he was just like, I can't with this. Like he was proponent from the beginning of like, you don't need to breastfeed. Like from the very beginning. And I'm very grateful and thankful, because believe it or not, and I know, there are some men that get involved in that bullshit.
Amen, sister.
What the fuck? And to those men, I don't give a shit. Like, fuck right off. Yeah. You are not the one breastfeeding. Yeah. Do not get involved.
Yeah, do not.
Don't. Be supportive. That's as involved as you should be in supporting the breastfeeder in what they're doing. You know, like further than that, your opinions on, hey, you need to breastfeed more. Why aren't you breastfeeding the baby? No, formulas, no.
change this position, change that. You're not doing it right.
Fuck to oblivion and beyond with that shit. If you're not supporting the breastfeeder, fuck off.
Yeah, and honestly,
that's all I gotta say.
Everyone is like already exhausted.
No, there's
and
no
your
room for
body,
that.
like your body's like going through a ton of changes, like as a woman.
You are not
like,
doing it.
We're just talking about the breastfeeding. Like we haven't even. It might be another episode that we can do about like hormonal changes in pregnancy.
Oh my god, yeah, that's a whole episode and a half. Even, like about that. So, it's like if you're not doing it, you have no say in it.
Yeah.
Like, what the hell? Yeah. Anyway, but like what I was saying about once you have like already expressed this milk and you have it out in the bottles or whatever, then you have to be careful with storing that.
With storing it. Yeah.
Okay, because you can't just like leave it out in the table or whatever. No, you have to like, for instance, I have here and I will post it up. It's like from the CDC, like, and I'm telling from the CDC.
Yep.
Okay, the type of breast milk, like storage location and temperatures of it. And it's specific, like freshly expressed or pumped milk, you could leave it in the countertop up to 4 hours.
Yeah.
Refrigerated up to 4 days. And then in the freezer within 6 months is best, but up to a year.
Yeah, but also like if the baby touches the milk, so like if you like pump 4 ounces, okay, and you gave
done,
that's it.
Done.
Like
Throw it.
Even if the baby left 3 ounces, you have to throw it
That's
away.
right. I totally, I think I repressed that. I think I repressed that.
So you have to like separate it before, because again, breast milk is basically like sterile. You know, so and I don't want to say sterile because sterile is like sterile. You know, it wasn't just the bottle.
But
it's like technically not sterile, but technically a clean bottle and stuff. Like it's a clean thing
to that environment, to that extent.
Exactly.
Yeah.
But once the baby feeds from it, that is no longer considered clean.
Exactly. Yeah. And
so,
dude, I think I have that repressed because.
Do you also have repressed about mixing the warm and cold milk in the fridge?
Don't even get me started. But like, tell me about the first repression.
Yeah.
Because MR was so difficult to feed, he would leave a lot of milk, like every time.
Oh my God.
No matter if I served him less, because then they're like, okay, we'll serve him less. No matter what, he would always leave. And I'm here like...
And I remember he would tire out at the end of the day. Remember that like he would feed like a good feed maybe 1 or 2 times in the beginning. And then at nighttime he would leave.
Yes. And then I'm here like... And then I take that, what he left, and I have to fucking throw it down the drain. And I'm like, oh my God.
No, there were times where I thought I would contaminate the field. And then I was like, do I save it? Do I throw it? And I would eventually throw it away. But I was like, I would cry because it was like, dude, I just sat down for
so
like
much work for
minutes.
this. And now I have to dump it.
Yeah. And people like think like, oh, it's just 30 minutes. It's half an hour. No, like the setup, you know, the pumping. And pumping burns calories.
Yeah.
That's why they say that breastfeeding, like you lose weight with breastfeeding, but because of how much it burns.
For instance, that's true for some people. Like my mom turned into a twig.
Yeah.
You know, and
I was very skinny when I was breastfeeding. And I wasn't even breastfeeding, I was pumping.
You and my mom are blessed. Me, I'm that other side of the percent. Nothing.
No, I was very skinny.
Nothing. Had the appetite of a damn bear.
Oh no, yeah, me too.
Of a bear. Like I wanted to eat everything in front of me.
Same.
But I did not lose it. I don't know if it's those stupid European freaking genes in me that are just like, no, we're going to hold on to this fat because, you know, you never know when you need it. You know, and there's a famine afoot.
A famine afoot.
Fuck those genes, okay? That's what I got to say.
No, I lost a lot of weight.
No, I didn't. I gained weight. After postpartum, I gained more weight than when I was pregnant. Ridiculous.
I gained weight when I stopped breastfeeding.
Ridiculous.
But then again, I didn't even gain that much weight when I was pregnant. I gained 8 pounds.
No, that's it. I gained very little weight throughout my pregnancy. Like in comparison to when I got pregnant.
Yeah.
I really gained the weight when I was breastfeeding because I was so hungry. Like it was the hunger.
Crazy.
Guys, like as much as I tried to explain it.
It's just you can't.
You can't.
You burn so much and there's so much nutrition that goes into making breast milk that you need to eat.
And even the amounts. Like,
but that's why a lot of like my patients will be like, oh, like doc, like do you think I should cut out certain things because it makes the baby like more gassy? And I always tell them, I'm like, listen, you need your nutrition. Yeah. You are going to burn a lot of calories making breast milk. So for now, you eat whatever you want to eat.
And that's the problem.
And then later, if we find a problem, we'll deal with it at that point.
Yeah. So that's why when I encountered that elimination diet, I was like,
I've never recommended the elimination diet. I think that's a very extreme because I would start like, less is more. So I would say the most common thing to cause an allergy to kids is dairy or milk protein. Okay. So I would say eliminate dairy. Okay. If we see an improvement, perfect. If we don't see an improvement, hey, we might need to eliminate other things, But like just straight up telling a person that's exhausted, that's worried, that's doing everything, that now they have to do basically a Whole30 diet. No sugar, no soy, no additives, no nothing.
Guys, give it a shot. Go anywhere that there's food. Look at the ingredient list. And please find me something that doesn't have soy.
Yep.
It exists, obviously.
It does exist. It does exist. And
but
you can have like a whole like nutrition.
Yeah, you could do it.
But it is very difficult, and especially for someone that's like breastfeeding.
And then at least me, when I started doing that, I was shocked by how many things I can't even remember it right now, but the things that I would least expect to have soy in it had it.
Yeah.
I'm like, what the hell? Why is soy in here? It's there.
Yeah.
It's there. It's just like, oh, whatever. Like, I mean, we could go on and on and on. But, okay, so I wanted to touch upon, like, really quickly before we sign off, like, because there are a lot of myths to breastfeeding. Okay. Because there's old wives' tales. Yeah. There's just the myths that are passed on, like telephone style, like, from person to person. Yeah. So then there's a myth of you can't get pregnant while you're breastfeeding or chest feeding.
Lies.
You see? And
lies.
That's a very popular one.
For the love of God, protect yourself.
It's a very common one.
I know. Super common. To this day, like, man, like, you Google everything.
Yep.
And you're going to tell me that you haven't come across something on Google saying you can still get pregnant?
I know, it's crazy. But it's crazy how popular of a myth it still is.
When people are like, oh, yeah, I got pregnant. I didn't think that I would get pregnant because I was breastfeeding. I literally, when they tell me that, I'm like, are you stupid?
Yep.
And I don't want to say that, guys. Like,
no, but still,
I don't say that to actual patients. But in my mind, I'm like, guys.
No, but I get it because it's super common.
I'm like,
it's a super common myth.
You can literally pull up the most random facts about some sort of diet that the mom wants to go on.
Yeah.
But you're going to tell me that you didn't look up if you could still get pregnant.
And then a lot of them say because they haven't had a period. Doesn't matter.
It doesn't matter. It's hormones. And
it doesn't matter.
Hormones. And remember,
you're still fertile.
You can still, exactly.
That
your body just doesn't like pause.
Yeah. Yeah. Your fertility is still there. Yeah. Regardless if, you have a period or not, it's still there.
You can still get pregnant.
Yep.
And for everyone wondering, you can, after you give birth, you can start birth control. You do not have to wait a certain time. Yes, sometimes that might mess a little bit with the production in the milk because it's a change in hormones, but it does not stop you from producing milk.
Absolutely.
Okay. So please protect yourself. I mean, obviously if you want to.
Yeah. Absolutely.
And an IUD, perfectly fine. It has no hormones. Doesn't
exactly. There's options without hormones.
So exactly. Yeah. So you can do that too. Yeah. We have options.
Condoms.
Yes, exactly.
No hormones.
But you can. Yeah. Point is that you understand that you can get pregnant.
Yeah. I mean, and if you want to get pregnant that soon, Godspeed, go for it.
Yes.
Me personally, absolutely fucking not. But if that's what you want, then go for it. Know that you can.
Yeah.
You can. And for instance, another myth that people with smaller boobs versus bigger boobs, it depends on your boob size.
Myth. I already know where you're going with this.
How much milk are you going to...
Myth.
The size of your boobs has nothing to do with how much milk you will produce.
I have moms that are AA cups and are overproducers.
Yeah.
So there's people that produce milk, but there's people that like overproduce.
Yeah.
And I have moms that are normal and overproduce.
Exactly. Because your boobs are pretty much fat.
Yeah.
Along with everything else that's in there.
Your breast milk is supply and demand. If you demand, it supplies. Okay?
That's
so if you tell me that you weren't able to produce enough milk, unless you have something else going on, like breast augmentation, things that mess with your actual anatomy, okay, your ability like to do that hormone production and all of that stuff, then you should have no problem if you are stimulating.
Yep, exactly. Another myth. You can't take any medications while breastfeeding or chest feeding.
There's some medications that you should avoid.
Of course.
Obviously, there's, you're
100%.
lactating, so there's things that can be passed through breast, like, women that are under chemotherapy and stuff like that. You shouldn't be
100%.
breastfeeding when you're doing that.
But there's a lot of medications
and stuff like that. But you can take like Motrin, Tylenol, all those things.
Exactly.
There are some meds that are safe, however, have been associated with decreased production. Mm-hmm. So there's a lot of like things that you can look up, and if anyone wants to look up if you're breastfeeding and you want to look up a medication, obviously go to your provider and ask them.
That's what I was saying. Talk to your doctor.
So talk to your doctor. Yeah.
But don't go ahead and think breastfeeding. That's it. I can't even take a Tylenol.
Yeah, exactly.
Don't think it's like that. It's not.
Yeah.
Because a lot of people like think that, and then they're like, no, forget it. I can't do breastfeeding because I have migraines or this and that or whatever. No. Like, don't
work with someone, and you will be able.
Exactly.
To do it.
And then another one. People that are high on their horses, they say breastfeeding makes your babies that breastfed babies don't get sick.
No, they do get sick. Let me clarify.
Yeah,
breastfeeding has a lot of amazing benefits.
Yeah,
okay. It does have a lower incidence of ear infections. It does have a lower incidence of getting sick in general. The reason why is because you're giving your baby antibodies. However, remember, you needed to have that exposure.
Exactly.
To get antibodies. And you can have antibodies, but that doesn't mean that you're not going to get sick.
Absolutely.
You just maybe might not get as sick.
Absolutely.
Okay?
Yep.
So it does provide protection, and I'm not trying to like trump breastfeeding and be like, I'm over here like saying it has a lot of benefits and like immunity and stuff like that. It does, but your baby can still get sick.
Absolutely.
Yeah.
Yeah. So don't listen to that. Yeah. And then the last one, some people have the assumption of like, you failed if you supplement with formula while nursing. Wrong. There's no failure in this.
Yeah.
Fed is best.
Yeah.
You do what you can. And we talked about it in length, but the thing is like, I feel like I have to like keep putting it out there because there are
still people that are like,
it's like, I feel like I failed. No, you didn't.
And maybe it's not coming from a bad place. I just feel like people don't understand that sometimes their choice of words can really hurt someone.
That's true. Yeah.
Because I think when I talk about, like, I exclusively breastfed till Nora was 8 months, and then I had enough milk stored to feed her till 9 months, and at 9 months I started formula.
Yeah.
Okay. So, and it took a lot of me to continue expressing.
I remember, especially because you were full-time working.
Yeah, it's awful. It's awful to pump at work.
It's a lot.
It's like pump before work, after work. You feel the pressure.
And dude, you're a full-ass pediatrician. You are so
and I had to pump
busy.
Between patients. They did not give me any time off. Yes, they were like, oh, during your lunch you can pump. So imagine me trying to keep everything clean and eat and do all these things. It's very, very, very difficult.
Yeah.
But
yes, it's a choice, but still, like, come on.
But yeah, exactly. I was very like grateful to do it, but at the end of the day, like, fed is best.
Yeah.
And it doesn't matter. I think it comes from a good place when someone. So that's what I was gonna.
Yeah.
Sorry, I kind of like digressed, but that's what I was gonna say. Like when I recommend breastfeeding to people, it comes from a good place in my heart. But if it's interfering with something and you can't do it as, hey, like, chill, like, take a deep breath, like, you have a lot on your plate already, like,
yep.
Let's work together. You tell me. That's what I tell my patients. What is your goal?
Yeah.
What is your goal? And I will work with your goal. And I have moms that's like, my goal is to breastfeed. I have moms that's like, my goal is to go back to work in a month.
Okay.
My goal is to breastfeed at nighttime, formula during the day. So that goal is very different for everyone. And as long as everyone's being respectful and being very careful of your choice of words.
Yeah.
But I am honest. I will say, like, there are benefits. Okay. And then, and I tell them that. I'm like, there's things that, like, I'm not going to lie to you about. You know what I mean? But I'm not going to stand here and make you feel bad about, like, some decision that is your decision. And it is best. It is what you decide is best for yourself at that moment in time.
Yep.
And that can change.
Yep. Absolutely.
I have a ton of moms that could not breastfeed at the beginning because of, I don't know, their kid was in the NICU or they just weren't ready. Mom had complications. How many moms have to stay in the hospital after? And then they're like, hey, doc, is it too late to breastfeed? No. but we need to work hard.
Yeah.
You know?
Yeah. Absolutely. So yeah, that's pretty much it. It's, I mean, coming from two moms, it's a hot topic.
Yeah.
You know, that's why it's going to be a little bit of a longer, it is a little bit longer of an episode, you know, than normal. But we thought it's important to bring it up, mostly like Evie said in the beginning, you know, it's the month for it and whatnot. And it's important for everyone to know, like, there is support out there too.
Yeah. Oh, yeah.
You know, there's support out there. And if another thing, if you don't have an adequate doctor that you feel that doctor, pediatrician or OB-GYN or whatever, even primary, is not supporting you, find another one.
Yeah.
Because it's just not right.
Agreed.
You know, find another one. There's millions of them out there.
Yeah.
You know?
And also don't assume that just because you had a bad experience with one person is that you're going to have a bad experience with the other, because Lord Jesus, I'm on forums and stuff like that. And it's like crazy how one bad experience with someone can really screw it up.
Absolutely.
Like, there are some people out there that they say some things and I'm like, my God, like, you're so wrong, you know?
Yeah.
So, you know, remember, not everyone practices the same. There's a million ways to skin a cat.
Yep.
So you just have to find someone that has your same goals.
Yeah.
And that's it.
Yeah. I can't agree more. So that was breastfeeding.
That was breastfeeding.
And so now we just started Patreon. I'm sure you guys have seen it on TikTok, Instagram, all those things.
We just did a really cool episode.
We did a really cool episode. I'm excited for that episode to come out. It's really, really cool. We talk about Brian Johnson. Just Google search him. You'll see what it is. It's crazy anti-aging stuff. Real, like, there's some conspiracy to it. We don't go into that, but we try to stay on the science part of it. And I think we did a good job on it, but it's a hot topic.
It is.
It was really cool, and we had a lot of fun filming that one. But check us out there on Patreon. We're going to keep on doing these and behind the scenes. This episode right now is going to be aired on Patreon because what we want to do is that we want to go ahead and videotape us doing these audio episodes that we produce out there in Apple, Spotify, all the streaming platforms. Yeah. You know, obviously for free and all that. But on Patreon, we're going to go ahead and upload them video format, you seeing us recording this. Exactly. So, you know, there's a lot of benefits to it. You will be supporting the heck out of us to get better equipment, keep up with our software subscriptions and everything, because, you know,
it really helps us.
It really, really helps us. And we thank you so much. Like, even if you don't subscribe to the Patreon and you just tip us any little bit,
really appreciate
thanks. Oh my God.
Like, from the bottom of our hearts.
From the bottom of our hearts. We love doing this. We really, really do. We have a great time doing this. But, you know, help is really appreciated. So check us out on TikTok, Instagram, now on Facebook too, because I just started that too.
Really?
Yeah.
I didn't even know about that.
I will send it over to you.
I'm like, really? Facebook? I love Facebook. I actually use my Facebook way more. I know. Yeah. I'm old school. Okay.
So we're on Facebook too. We're on everything. We're on Good Pods as well, which is like
Good Pods. Oh, and what's that?
Wisdom app.
Wisdom app. Yeah.
We're also on the Wisdom app. We're on almost everything. So look us up on Funny Medicine Podcast on almost everything out there.
Yes.
And we'll see you on the next one.
See you on the next one, guys.
Bye.
Bye. Woo.